Good afternoon. Good afternoon, all. You're welcome to today's lecture. We are still on the course Basic Dispensing Theory 1, BDT 152. Okay, please, one house, please. One house, please. All right. We are still on the topic Suppositories and Pessaries, Part 8. This is our 8th contact on this topic, and we are gradually coming to the end of the topic and BDT 152. So in our last lecture, we treated the preparation of what? Suppositories, where we discussed the 4 methods, right? What are they? Hand molding, compression molding, and what? So when we discuss another automatic, we have the word rotary and what? Linear. So we discussed this in detail. Now we are moving over to the specific problems in formulating what? Suppositories. The problems you can encounter or you encounter in the manufacture of what? Suppositories, so that you know how to overcome these problems. That's why we want to discuss them. So number one of the first is water in what? Suppositories. Water in what? Suppositories. So water can be an issue. Another one is hygroscopicity. Hygro what? Scopicity. Hygroscopicity. Then the third one is what? Incompatibilities. There are a lot of incompatibilities in suppository formulation. Then even though viscosity also has its own, there are issues with viscosity, especially with low viscosity. So we discuss that. The next one is what? Brittleness. Of course, we discussed most of these things. 2 of us, we've mentioned their effects, but we just want to gather them together as what? Problems. But we have discussed them in detail, everything here, and what they can do and what they can cause. Now the next one is what? Volume contraction. Yeah, even though contraction is advantageous, okay, contraction is advantageous, it can also be an issue. So you look for a way to do what? Overcome it. So the next one is what? Rancidity and the use of antioxidants. So rancidity, we discuss rancidity in detail. So it's no longer a new thing for us. So now let's go over to the water in what? Suppositories. So use of water as a solvent should be avoided. Are we together? Use of water as what? Solvent. Try to avoid using water as what? Solvent. These are the reasons. Of course, you all know that water accelerates what? Oxidation of what? Fat. In fact, water is a medium. Water is a medium for a lot of what? Reactions. Am I communicating? A lot of reactions. So, of course, when fat are oxidized, what you know what it means now? It leads to what? Good. Thank you. So, water makes it faster. Accelerate what? Oxidation of what are they discussing? What did I say about water in suppository? Tell us what I said about water in suppository. Okuka, I'm talking to you. Yes. So what did I say about water in suppository? Oh yeah. I'm listening. I leave my class now. Join her. Yeah, fast. Two of you. Fast. Go there and gist well. Please, if you are in class, be in class for it. Okay? If you are in class, be in class. If you cannot stay in class, go. I will allow you to go. My life is so simple. If you don't want to stay in my class, do what? Go. Don't stay and be constituting what nuisance. If you don't want to stay, go. You are allowed to go, please. Now let's continue. Another issue is that if water evaporates, the dissolved substances will do what? Crystallize out. Are we together? So what you have already formulated, right? If you use water as a solvent, fine. And water will do what? If water does what? Remember, some formulation, heat is involved, remember. So if water does what? Evaporates. What will happen? The dissolved substance will do what? Crystallize what? Out. It's an issue. So you avoid what? Use of what? Water. Now, you still do emulsion. Oil and water emulsion. I think that should be a second year topic. Emulsion, oil and water. I think, but I mentioned it in your first semester. I said one or two things about it, right? So where you can have water in oil emulsion, and you can have oil and water what? Emulsion. If you have oil and water emulsion, then the oil in water, the oil is, you hear something like this. This oil and water, and this water in what? Oil. So what it means is that this oil is dispersed in the what? The water. The oil is the internal phase. It's taken as the what? Internal phase. While the water here is external what? Phase. Okay? Or you call either internal phase or dispersed phase. Or this one is dispersed or continuous what? Phase. Now, if you have water in oil, here now what it means that water is what? Internal phase, because it's inside the oil, right? While oil is the what? So if you see water in oil emulsion, because oil is more, will be oily. Am I communicating? Just as you have some creams. Have you noticed that some of your creams, some of them are oily, some are not oily. So that one that is oily is actually water in oil, because oil is more. The one that is not oil is oil in what? Water, because water is much. Now, so the one outside, the one that has the one in which another one is dispersed is the dispersed phase, or so is the what? Continuous phase or the external phase. Now I know why I explain, because I want to mention something here. That's why I explain this. You understand it. You do it more when we enter your what? Second year. I just discuss it to talk about this to prepare your mind towards that. Okay, now listen carefully. Unless water is present at a level more than the required for dissolving drug, unless water is present more than the level required to dissolve what? The drug, water has little value in facilitating what? Absorption, drug absorption. Unless the level of water there is above the level required to do what? Dissolve the drug. Water has little what? Effects or contribution towards what? Drug what? Absorption. So when you have in emulsion form, oil and water emulsion, absorption from water containing suppository is enhanced only if an oil in water emulsion exists. Absorption from water containing suppository is enhanced only if an oil in water emulsion exists with more than 50% of the water in the what? external phase, with more than 50% of the water in the what? External phase. That is when water can do what? Actually do what? Facilitate what? Absorption. Remember, I said that except if the level of water present is above the level required to do what? Dissolve the what? Drug. Water has nothing to contribute in facilitating drug absorption. Now, if you go down deep, you have to talk about, except you have an emulsion where you have oil and what? Water and emulsion, and 50% of the water are in the what? External phase. That is when water present can actually help to do what? Facilitate what? Absorption from what? Absorption from what? What are we discussing? Where water is used, right? Good. Now, another issue this has is this. Of course, I think I've mentioned it in our last class. Water serves as a medium for many what? Reaction. Most of which may not be favorable to the what? The integrity of the what? Suppository. Most of them are not to the good of the what? For the good of integrity of the what? Suppository. So reaction between ingredients are more likely to occur in the presence of what? Water. Because water mediates a lot of what? Reactions. Am I communicating? It's a very interesting medium for a lot of what? Reactions. Now, remember, I also said that in the morning, I mentioned this in the morning, that when you incorporate water, if you must incorporate water or any other substances that are prone to bacterial attack, am I communicating? Of course, you know that where there is water, you are welcoming, in fact, fluid, anything liquid or fluid, you are welcoming what? Bacteria and what? Fungi. Three of us, you are welcoming them to come. Hey, you will come and do what? Come here into this surrounding and do what? Multiply. That's what they're telling what? Bacteria and what? Fungi. Am I communicating? Good. Now, so incorporation of water or any other substance that might be contaminated with bacteria or fungi, there's a state the addition of what? Preservative or bacteriostatic what? I think I mentioned this in the morning. Bacteriostatic what? Agent like what? Paraben. Like what? Paraben. Now, have you seen why you don't? Yes, if you must, you can add what? This preservative, but water should be avoided apart from the bacterial and fungal contamination. There are other issues that borders on the what? Integrity of the what? Suppository. So avoid what? Use of what? Water as what? Solvents, if you can. Okay. Now, when we talk of hygroscopicity, we've discussed hygroscopicity of most of these bases at full length. Three of us, we've talked about them. So I don't think we have any issue again on this what? On what? Hygroscopicity. We mentioned glycerinated what? Gelatin. We said they are hygroscopic, right? And we also talk about what? PEG, right? They are also what? Hygroscopic. And we discussed the effects of this, their hygroscopic nature on their integrity, so that you know how to handle them. We'll discuss them at length. I wouldn't want us to waste time there again. But just listen. Glycerinated suppositories, when exposed to dry climate, they lose what? Moisture. But when they are present in an environment of high humidity, they will do what? Either way, mess up the whole thing. Am I committing? Good. When they lose, of course, it will affect the what? The fluidity, right? What do you think will happen to the brevethness? Will it be brevetho? Yes. Then when they absorb, that one is also another what? Issue. So the same thing happens with what? PEG basis. So let us not waste our time here. Now, incompatibilities. We also discuss incompatibilities in one way or the other of the basis. In fact, there was no base we didn't talk about what? Incompatibilities. Three of us, from Tiruma oil down to PEG, down to glycinated what? We talk about this. So this is the kind of summary of what we have already discussed. But let me just point them out again. So PEG, for PEG basis, polyethylene what? Glycol. What happens? What happens here is that polyethylene glycol, they are what? Incompatible with what? Silver salt. I mentioned it, right? They are what? Incompatible with what? Silver salt, tannic acid, amino what? Purine, quinine. So that means if you must, let's say you want to formulate, even though it's not common here, sir, you want to formulate, suppose using PEG, you want to formulate quinine, then they're not what? Compatible. Okay? They're not what? Compatible. Then ethanol, aspirin, benzocaine, and sulfonamides. These things are incompatible with what? Polyethylene glycol. So you be careful if you are in a place or in a company tomorrow or a factory tomorrow, manufacturing outlet where they want to use PEG for this, to formulate any of this. You say, yeah, no, yes, I learned and I also researched that this should not be used. Please, let's look into it again. Okay, so another point I want to make here is that many chemicals, they have the tendency to be what? Crystallized out of what? PEG. Many chemicals have the tendency to be what? Crystallized out of what? PEGs. Example of such are sodium sorbitol, salicylic acid, camphor. I think I explained what it means to crystallizing out, right? It comes right. Yes, it's no longer a new term for us. It's not right. Good. So I said, if you use PEG for these things, they do what? They are prone to do what? Crystallize out of the what? The whole thing. So it's an issue. So avoid the use. Okay, this is also another type of what? Incompatibilities. The other one is that when you have high concentration of what? Salicylic acid. When you have a high concentration of what? Salicylic acid in PEG. See what it does? It does what? It softens the PEG from suppository consistency to what? Ointment consistency. Who has seen ointment here? You've seen ointment, right? Yes. You've seen sulfur ointment. You've also seen penicillin ointment. You see how it is, right? Yes. That's semi-solid. So in higher concentration of what? Of what? Salicylic acid softens what is supposed to be solid, softens it to become like what? Ointment. Is an issue. No, tell me, can you insert ointment? What has the same consistency with ointment? Can you insert it? If you put it in your hand, before you even, it will just, so it cannot work. So be careful in formulation. Are we together? Yes, so I say that higher concentration of what? Salicylic acid softens PEG to ointment what? Consistency. To ointment what? Consistency. Okay. Then in your chemistry, you know what complexes are, right? Complex reaction. You've done acid, base, and salt. Yes. Do you do complex salt? Yes. You now know what complex is, right? Yes. Hey, see, whatever you are doing now is not for you to pass your exam. I keep saying this. They have applications. If you don't understand what you did in complex, if I say what I want to mention now, if I mention it, you'll be confused. You start asking, sir, what are complex again? That's why you did it in your chemistry. Please take everything you are doing here seriously, because from second year, not even second year, this phase you start seeing the word application. By the time we enter second year, or you even enter university pharmacy, pure pharmacy, as in now enter pharmacy, you keep seeing, you may not see chemistry as a subject, as a course. You may not see biology as a course, but you start seeing the word application. So if you don't lay the foundation now, you keep having issues. Okay, please, I keep saying this. This is not the first time. So now diaspirin complexes with what? PEG. Remember that the base is not supposed to do what? React. True or false? Yeah. With the what? With the what ingredient? Remember. Now, if you now formulate diaspirin, what will happen? It will start forming complexes with the PEG. It's an issue. True or false? It's an issue. That complex formation is a reaction. It's an issue. Because you should not form that. The PEG is meant to deliver it. True or false? When you form complex, when you will be able to deliver it, it cannot release it now. True or false? It cannot release because they have already formed bonds. True or false? A bonds have already been formed, so it cannot release it. He cannot. So that's why you should be careful. That's why they say that all these things should be what? Inert. They should be what? Inert. These bases, they should. Except which one that have laxative physiological action, laxative effect? Which one? Which are the bases? Huh? Okay. Can you know, I got your question. Alright, so let's continue. Penicillin G. Let's look at penicillin G. Penicillin G, fine, is stable in what? Cocoa butter. Fine, is stable in what? Cocoa and other fatty what? Bases. But when you use PEG, what happens? It what? Decomposes. When you use PEG, it decomposes. It's a sign of reaction. True or false? It decomposes. I ask again, which of these bases we discuss have physiologic action? Laxative, which one? Which one? We have having physiological action as part of one of the disadvantages. Which one? Which one is that? Glycinated. True or false? Is it glycinated, gelatin? I shouted it here, I sang it here, I mimed it here. What didn't I do here with that particular disadvantage? Guys, what? Okay. Now let's continue. Now, fatty bases that have what? Significant hydroxyl values may react with what? Acidic what? Ingredients. Fatty what? Bases with what? Significant hydroxyl value will react with what? Acidic what? Base. Acidic what? Sorry, ingredients. So you should be careful on some of these bases that have what? High hydroxyl value. Because any ingredient that is acidic, you incorporate, they will do what? They will react with it without wasting time. Okay, these are some of the incompatibilities associated with what? Suppository what? Formulation. Have you noticed that everything borders on the base? Have you noticed that? Yes. So the bases are very, very important. In fact, the base, whatever you are going to use, watch out interaction of that thing, or whatever you want to formulate, watch out its interaction with the what? The bases. Very important. If you choose your bases correctly, okay, let's continue. Viscosity. Viscosity. Remember what we said about low viscosity and sedimentation. Can you remember? Can you remember? Low viscosity and what? Sedimentation. Now, when during the preparation, viscosity of a melted base is very important. Watch it out. Watch out viscosity of the melted base. If you melt the base you're going to use, watch out its what? Viscosity. It has a lot impact to make in what you're formulating. So the viscosity of melted base is important. Check out for its viscosity when melted. It will, if you melt it and it's watery, it's a problem. Check out if the viscosity is low. Check out there's high tendency of sedimentation to do what? Take place. And it's an issue. So check out the viscosity of the melted base you want to. You melt it first, then see how it is, right? So the viscosity of the melted suppository base is important in the manufacture of what? Suppository. At the same time, it also determines its property when or behavior, as case may be, in the what? Rectum. Its release profile and also when it enters the what? Rectum, it affects its behavior in the rectum. So watch out the viscosity of whatever base you want to use. Now let's now go down to the business. Cocoa butter has this issue. So melted cocoa butter has a very low viscosity when compared with what? Glycerinated what? Gelatin and peg. Melted cocoa butter has low viscosity when compared with what? Glycerinated gelatin and what? Peg. So what happens? Of course, I think I've talked about this time without number. I've talked about this several times, that this will definitely lead to what? Sedimentation. Okay? Sedimentation of the suspended, they will sediment because of the low what? Viscosity. And it's an issue. So you should be very careful while doing what? Handling cocoa butter, because of that low viscosity. But you can actually overcome this. What is that? What did I say about viscosity and sedimentation? Yes, I'm asking you. What did I say just now about sedimentation and viscosity? So tell us, stand up and tell us. Let's hear from you. Stop looking at that material. Tell us. And you, close that phone. Close that phone. I said, what did I say about viscosity and sedimentation? What do they have a relationship? Do they? Okay, tell us what is the relationship between sedimentation and viscosity? Oh yeah. Come and take mic. Oh yeah, speak out. Let's hear you. Fast. You say what? Keep that phone. You see? How are you? Stand up. Tell us. I said, the question is this: what is the relationship between? You didn't hear me. You see, that is the problem. She turned like this, and they were gisting while lecture was going on. And there in front seats, two of them. She turned. She didn't know I was just watching them. You know, not gisting. They were lost in their conversation, and lecture was going on. That's the problem. I gave you the chance to leave my class if you don't want to stay. So why are you here and you're not following? You are gisting. You are doing what? Now you can leave my class. Leave fast. Go and continue your education there. And if I send you out of my class, I'm sorry, I will not allow you to my class again. Leave. Tomorrow they'll give you quiz, you say they didn't teach us this. And it's very easy to say it outside. He didn't teach us this, so he just gave us this in an exam. He didn't teach it, but they are just in here. I don't understand. Seriously, how do people do it? You leave your hostel and come to class and you're just in class. What you paid for? I don't understand it. How do you do it? Almost how much? What you paid for, and that thing is going on. You are gisting. How do you do it? It drives me crazy. If I think about it, it drives me crazy. On a more serious note, and her parents are at home. She's in school. He's in school. Okay, so we can overcome this, right? So how do we now overcome this? If you are tired, see, if you are tired, you are losing concentration in class, you do what? Maybe you are feeling sleepy, you can stand up. I allow you, you can walk around my class. I don't care. That is how things are done. Once in a while, you may lose concentration. Yes, stand up, walk around. Stand up. Instead of staying in one place and be gisting. Or if you don't want to, if you can't tolerate development entirely, do what? You can go out. Afterward, doing seminars, people can go out and come in. Three of us. I will allow you, I will not force you. Maybe those places you miss, you can watch the what? Recordings. I will allow you, but staying in my class and be gisting is wrong. It shows that this man is wasting his time if you don't know the meaning. You know, you do some things without knowing the implication. You do some things without knowing the implication. If I'm here talking and you're listening, you are calling me a fool and wasting my time here. That's what I'm telling you to my face without even knowing. Okay, all right. So how do we now overcome the problem caused by what? Viscosity. If you must use this basis with no what? Viscosity. What will you do about it? So that means you start looking for a way to do what? Overcome it. Because probably there is no other base you can use, or because maybe your company cannot afford those ones. This is the one we have. You start looking for a way to do what? Overcome these what? Issues. If there is a way to do what? Overcome the issue. Now that's why we have these things, ways to overcome. So to overcome the problems caused by use of what? Low viscosity what? Basis. Number one, you try as much as possible to sell, even though the base may have low viscosity, you select among them the one that have what? More narrow melting range. That is closer to the what? Body temperature. More narrower melting range that is closer to the what? Body temperature. Am I communicating? Yes, sir. It can also be a way, or you can also include one or two things, additives. So those things you can include as follows. You can include 2% aluminium mono what? Stearate. 2% aluminium mono what? Stearate. Mono what? Stearate. You can include 2% aluminium. This is just okay. Aluminium mono what? Stearate. So what does this do? What does this do? It has two effects. Number one, it increases the viscosity of the fats, the fat base. Good. It also maintains homogeneity. No problem. It's okay. You want me to read it the way it is? It's okay, no problem. It does, but to do what? Maintain homogeneous suspension of what? Insoluble material. It's not homogeneity of the what? The whole system, right? Is what? Is something, right? Yes. It makes it what? Homogeneous. Two of us. You say no problem. Anyone, just know that the most things I do what? It maintains what? Homogeneous suspension of the what? Insoluble what? Material. That means it will uniformly what? Ensure that they uniformly what? This pass, okay? These three what? Butyl, okay? Yes, good. Even though suspension on his own is actually a heterogeneous mixture. Three of us. Yes. But homogeneity here is not talking about making it, it's talking about uniform what? Distribution, okay? Remember that low viscosity, listen carefully, remember that low viscosity causes what? Sedimentation. So the homogeneity we're talking about here is that uniformly, it makes sure that those things that were supposed, they were meant to sediment because of the low viscosity, they are uniformly what? dispersed in the entire world system. That's what we mean. That is the type of homogeneity we're talking about here. Not to render a suspension that is heterogeneous to what? Homogeneous. There's no, that one is not possible. Suspension is what? Suspension. But we're talking about uniform distribution, so that they remain suspended and not what? Sedimented. Okay? They remain suspended and not what? Sedimented. Okay, so that's what we're talking about here. Okay, so that's the two functions. It increases viscosity. It makes it to be what? It will increase the what? Viscosity. At the same time, helps to suspend the what? Alright, so now there are others that can be added to improve the consistency. They are as follows. We have cetyl. You can add cetyl. You can add sterile or myristyl alcohol. You can add what? Cetyl. You can add what? Sterile. You can add what? Myristyl alcohols, or even stearic what? Acid. You can add these things to do what? Improve the what? Consistency. 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 Okay. So another issue I wanted to look at is what? Brittleness. 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 This term is not alien to you. Three of us is not alien. We've discussed it several times. I kept mentioning it, so it's no longer new. But let's just fulfill righteousness to say by saying one or two things about it. Okay, now listen carefully. Cocoa butter has an edge here. Okay? Cocoa butter has a very important edge here. Okay? Good. Suppositories made from cocoa butter are elastic. So they are inherently what? Plasticizing. Three of us, they are elastic on the and they don't do what? Fracture readily. Suppository made from where? Cocoa butter are what? Elastic. They don't fracture readily. Kudos. Kudos, okay? But synthetic fat base, we discussed this when we talk about synthetic fat. But synthetic fat base with high degree of what? Hydrogenation and high stearate what? Content. What happens? And a higher what? Solid content. Three things. To temperature are what? Brittle. They are more brittle. They are more what? Brittle. Synthetic fat base that are what? They have what? High degree of what? Hydrogenation, high stearate content, higher what? Solid content. They are what? At room temperature, they are what? Highly more what? Brittle. So what can we do to improve the fluidity? If you must use them, what do you now do? You know there are substitution. Yes, even though theobroma oil, suppository from theobroma oil, they are elastic, wonderful. But there's a situation where you cannot use them, and you have to use this synthetic fat. What are you going to do? You now look for how to overcome what? This issue. Am I communicating? So what do we now do to overcome this problem in synthetic fat base and another bases that are prone to what? Brittleness. So first of all, you try as much as possible. You know, there is this temperature difference between the what? The melted base and the what? The mold itself. You try as much as possible to ensure that the temperature difference between the what? The melted base and the mold are what? Minimal. So try to draw close, achieve the what? Almost the same what? Temperature, if possible. Let it be what? Minimal. If we be able to achieve it, at least you can do what? Overcome this. You can also add plasticizers. Okay? You can add plasticizers. You can add to 80. You can add to 80. You can add castor oil. You can add what? Glycerin. You can add to it 80. You can add castor oil. You can add what? Glycerin. This will impart plasticity to this fat. Okay? So making it not to form suppository that will fracture easily. making it to be able to produce what? Elastic what? Suppository that will not fracture easily. Now, please, as we move, any question ask, do not waste time. Ask your question as we move, because we are moving with the speed of light, no time to waste. So, volume contraction, keeping quiet means that you are following. See how these are looking at me. Maybe did you have a question? I was really happy that you want to ask question. Okay, ask. Ask now. Me? Eh? How? I don't understand. Do you have a question there? Why not? Why not? Why not? Why won't I answer? No. She ask question. Ask. Hello. Hello. Someone want to ask question. I don't have to ask. I ask. Okay. Why? Okay, it's okay. Sit down. Sit down. No. She asked, hello, hello. Now let me correct an impression, please. In as much as I smile, but please, you will meet in the course of your practice. You will meet some personal questions like this, even more personal than this question. Am I communicating? You see how you will laugh when your patient asks you such question. Maybe the patient is trying to look for who to ask. He or she looks at your face and feel that she can talk to you in the formal sort of time and come and ask you start laughing. No, it starts now. Hey, it starts what? Now. It's part of the training. It starts now. If you don't know you should comport yourself and ask a question, you may mistakenly laugh. Then he or she will stop coming to your premises. I am going to at this practice. In the practice, I am a lot. Your ability to keep things confidential. What makes you a pharmacist or healthcare professional? And how you comport yourself when the person, a lot of things. We know a lot of things. A lot of people confide in us. Yes, a lot. A lot. So how do you now comport yourself, help the person? So you laugh first. After laughing, then you now say, hey, what did you say? Alright, so she asked a very important question. She asked, can a virgin use the word insert? See, if there is no choice, if there is no other way, you know some of these infections may be local. This systemic may not do much. If there is no other choice, and if the cream cannot be, hope the issue is the issue of hymen, right? That's the issue, right? Hymen and treating someone for infection, which one is more important? And must we even push it to that extent? Am I committing? So that one and treating serious infection that may lead to be what? Pelvic what? Inflammatory disease in later life. Which one is more important? If you don't treat most of these vaginal infection properly, it can lead to what? PID in future. And that will affect implantation. Because the walls are inflamed. True of us, it may lead you start seeing you will not be able to conceive, because yes, fertilization has taken place, Can implementation take place? That's the problem. So it's a very serious issue. Depending, that one is what the person, depending on the person, the what and what the person is treating. Am I communicating? So that one, yes, if there's no other way, you have to use it too. Hello? Uh-huh. And that doesn't mean that you're no longer a virgin. Hello, listen. Virginity has grown the level of physical virginity. It's more of the mind thing. You may not have done something physically, but in your mind, you are not a virgin. You have done a lot of things. A lot of things. That is not penetration. True of us. So what are talking about? You're not going to be a virgin if you are not lying. Forget that physical one. You're not going to be a virgin. All right, thank you for that question. Okay, so the benefit risk ratio is what is the doctor that will determine that, how important it is to treat this. Okay, it is just what normal cream can just take care of without pushing any insert. It's just normal cream to rub in the bobo area on the. But if you can take care of that, no need pushing inside. Allow her and her virginity to stay. But you must even push it deep to that level extent. You must not. Hello? Hi. She took us. Anyway, it's good. Now let's go back. Where did we even stop? Volume what? Contraction. Volume contraction. Now, all this while we've always known that contraction is very important for what? Release of the what? Ejection of the suppository from the mold. Two of us. We have always known that, right? How important it is, right? Hello? Hi. Next, what did I say now? Yes. What was the last statement I made now? Yes. Tell us the last statement I made before calling your name. So tell us. You don't know. You are making noise. You are gisting. And you are answering. How will you be in class and your lecturer is speaking? You can't even say the last thing is. Then you're not in that class. Must I send everybody away before you realize the importance of sitting down to listen to class, to my lectures? What is going on here? What do I do with you now? Tell me. Must I send everybody away before you understand the point I'm trying to make? Must I send you away? I'm even tired of sending you away, sir. I'm tired. Because I don't like it. You are forcing me to do what I don't like doing. The first two people have left, second people have left, still you continued. Okay, now let's continue. So I said that contraction, as we know, helps in what? The release of the what? Supposing, but they need to contract and leave the wall of the what? The mold. But sometimes on the process of contraction, you may have what is called contraction holes. Contraction hole may do what? Develop. Am I communicating? And is what? An issue. Are we together? Is what? An issue. In fact, basically, some bases that have good contraction, they don't have issues with what? In fact, they don't even need lubricants. You call a lubricant or what? Mold releasing what? Agents. You call a lubricant or what? Mold releasing, and that name has entered though. You call them what? Lubricant or what? Mold. You don't need any of them. For some But because of that they are good contraction property, sometimes you may have what is called what? Contraction hole at the open end of the what? The mold. And when this happens, this thing can cause you to have a suppository of low what? Weight. Okay? Lower than the normal weight it should have. Am I communicating? So remember, how do you not take care of this? Remember what I told you about the main thing you can do to take care of it. Remember what I told you, that you should pour excess molten form of the what? Mixture. I remember, you pour excess so that you can scrape. Remember when we discussed that, right? Yeah. So if you pour excess after you can scrape, it's okay. You can take care of this what? Contraction work. Basically, any other thing is just long story. Are we together? So you can pour excess so that at the end you can do what? Scrape. So let's look at lubricant or resin mold. Just say one or two things about them, then talk about acidity, then we are done for today. We are done for today. Just, and I don't think I need to talk much again. I'm talking about it just to mention one or two things, okay? So basically, cocoa butter adhere to what? Suppository what? Mold. Cocoa butter adhere to what? Suppository mold, because it has what? Low volume what? Contraction. So that means if you formulate a suppository with cocoa butter, please ensure you have what? Mold releasing agents or what? Lubricants in the what? Mold. Remember that. Okay? So if not, you will mess up the whole thing. So various lubricants must be used to overcome the problem. Examples: we have mineral oil, aqueous solution of sodium lauryl sulfate. I'm giving examples now. Mineral examples of what I'm talking about. Mold what? Using what? Are we together? Mineral oil, we have aqueous solution of sodium what? Lauryl sulfate. We have alcohol, we have silicones, we have soap, and what have you. So sometimes you may have mold that are damaged. Even if the mold is damaged, you can still work on that by coating the cavities with what? With what? Teflon. Teflon is what? Polytetrafluoro what? Ethylene. Polytetrafluoro what? Ethylene. Teflon. You can use it to do what? Coat the what? Cavity, so that you can easily do what? Release it. That is, in case the mold is what? Somehow what? Damaged. You can take care of that. So you can release, they can easily release the what? Suppository without having issues on the what? Suppositories. So we have bases like tuboma oil has this issue of contraction. We have what? Glycerol gelatin base. Lubricant there, you can use soap spirit, you can use liquid what? Paraffin. Then, but for synthetic fats and macrogols, you don't need what? Lubricant. Remember, you don't need what? Lubricant for them. Good. But for tuboma oil, glycerinated, you can use what? Lubricant. Example: soap, spirit. We have your what? Your what? Liquid what? Paraffin. So the last one we are going to treat is rancidity. We'll be talking about rancidity. But this class is filled with what? Rancidity. Almost all the classes. Rancidity. So it's no longer a new term to you. So I don't think we waste time here. Of course, you know what causes what? Rancidity. Oxidation, even water, a lot of things can cause what? Rancidity. I'll just read it to then we'll go. Rancidity results from what? The auto-oxidation and subsequent decomposition of unsaturated fats into low and medium what? Molecular weight saturated and what? Unsaturated aldehydes, ketones, and what? Acids. Okay. Examples: to take care of this, you can add what? Antioxidant. To take care of this, you can add what? Antioxidant. So example of effective antioxidants are the phenols. Under the phenols, you have your hydroquinone and your what? B what? Naphthol what? Quinone. B-naphthol quinone. So I think we'll stop here. We've tried for today, right? Do you have any question? All right, we'll stop here for today. See you tomorrow. We continue from the evaluation of suppository from tomorrow. Thank you very much. God bless you.